for October to order?
Hey, Rob, hold on a second. Let's make sure Oswaldo's ready.
I'm sorry.
Okay, go ahead. Sorry.
Do I have to do it again or we're good?
No.
Okay. Social services? It's Bob?
Good afternoon. I have a few requests here. The first request is for the approval, and this is an annual approval that I seek at the end of each year for renewal of existing contracts for 2021, and then the list of providers is attached to the request.
So this is a do-over from last year, Bob?
Yeah, it's a way so that we're not doing them all individually. I just put the provider in a list, and any questions anybody might have, I answer now, and it saves time later.
Contract amounts are the same?
They're a little less because the savings built in for 21 based on the reductions.
Okay, I'll move this.
Second?
Second, Sterling.
All in favor?
Aye.
Aye. Opposed? So carried.
Thank you. The second request is to renew an existing agreement between my Columbia County DSS, the Director of Public Health, and Twin County Recovery. And Jack's on the line, so I'll just thank him again, but he gets grant money that allows for folks who are adept at substance abuse, whether it's alcohol or substance abuse. That's very helpful when CPS has to respond to situations, or when foster families are working on that issue. And so that is somebody working directly from Twin Counties with our agency through funding that Jack was able to get.
I'll move that.
I'll second it.
All in favor?
Aye.
Aye.
Opposed? So carried.
The third request that we have for you today, there's a gentleman by the name of William Beecher. He's a PhD. We have certain children that exhibit, certain behaviors that demonstrate some risk. And there's an expertise in the field of fire starting, and sort of being able to diagnose that and begin to treat that at an earlier age. And we did not have an expert in that field, so we sought that out. And this gentleman can provide that. So I just request that we be able to contract with Dr. Beecher. Again, as all others, it's per diem as needed.
Was this a budgeted item?
I'm sorry, say again.
Is this a budgeted item? Money in your budget for this?
Yeah, I mean, it comes out of the services, so it gets paid through the case.
Okay.
I'll move it. Morel.
Second?
I'll second.
Eldridge? All in favor?
Yeah, I just,
Go ahead, Kat.
he's not on salary. He's just per diem. So,
He is per diem.
okay, all
Correct.
right. Okay, thank you.
All in favor?
Aye.
Aye. Opposed? So carried.
And the final request is a request to increase revenue in the furniture and furnishings budget line. We did that through a budget transfer. We worked that out with the controller's office in advance. We actually had a what they call a SNAP bonus award grant that was given to us from the state, and there were monies left, so we were able to move that over into our furnishings line to catch that back up, because we use we use a lot of the SNAP to get up to speed as far as working remotely when COVID hit. We got some equipment and things like that. So we just wanted to transfer and get that line back to even.
Any questions?
I'll move that. Yuri?
Second, Mussman.
All in favor?
Aye.
Aye.
Opposed? So carried.
And that's the extent of our request. Thanks very much. And I'm here to answer any questions either now or I will stay on the line throughout the meeting.
Bob, can you just give a quick update on the Galvin Civics Motel, please, just so everybody kind of has a sense of how that's going?
Oh yeah, absolutely. Yeah, pretty excited. So the vendor that we had, MHA, wanted to pull back and just continue to provide care coordination. So we got St. Catherine's, who was working with us here in the building, to come in and sort of take over the day-by-day case management out there, which was very good because they were able to assign people to it that have a lot of experience with Marillac up in Albany, which is sort of more of a shelter-based system, but they can bring that type of experience to bear on the day-to-days out at Galvin. And they just came in the last couple of weeks. So that's very good. They are actually bringing forth some laptops. As you might remember, I wanted people to be able to do job searching right on the premises. At this point, I'm told by St. Catherine's, because they had some of that hardware available, they can bring it down and get that started sooner rather than later. They brought different kitchenwares down so that the kitchen can be utilized by families that may need it. So going pretty well. We're still working through the COVID distractions, so really there's limited capacity to do any of the casework in a group setting, which is what we hope to do, but we want to bring that on. And I'm working with Galvin and some of the supervisors to see if we can, move forward and get some of the other things, just from a logistical standpoint that we had been, sort of anticipated through the contract that were a little slow to come. So we're working through that as well. So, I'd like to see more progress in 2021 as far as the grounds are concerned, whether that be a green space and a little playground for the children that we talked about. But I have to say, all things considered, given that COVID did come in and hit us pretty strongly within the first 5 months of operation, I feel like we could have been a lot further behind than we ended up. And I couldn't be more excited about the operator who has taken over day-to-day case management.
Thank you, Bob. Anybody have any questions for Bob on that?
No, I don't have a question, but I have a message for him from the Greenport Planning Board. Mr. Stifler asked if you could give him a call Monday at your convenience.
Oh, absolutely, I can, yes.
Okay, he's there in the morning after 8. Okay?
Mornings after 8, I will certainly do that.
Yeah, Monday
Thank
morning. Yeah, if you could give him a call. Thank you.
Will do, thank you.
All right.
Thank you.
I have a couple of questions. One is about Galvin. Are they holding up their end of the deal, do you feel? And then,
Well, I'm sorry, go ahead.
the second question is just, I see the homeless numbers creeping up in general. And what are you thinking for this winter and the future for that?
Well, I'll take the second first because it's the most fresh, and I just had a meeting about it today. Two things. This is the time of year where that typically happens. You start to see the numbers go up, notwithstanding this little warm spurt we're experiencing now, but that's going to go up. And I expect the type of numbers that we've had over the last couple of years. So at the height of it, I feel like we're going to be into the three figures, you know, whether it's 105 or 110. And, you know, we barely have capacity for that. That's still the same, despite the fact that I feel like the program we can offer, particularly in the Galvin, is much better. And that does seem to be moving people into more permanent situations at a pace that's much better than it was. So I'm optimistic, but that's, you know, that's still very much a work in progress. So that's number two. And of course, number one is important. And it's why I brought up, you know, there's some things that are not fulfilled by Galvin, and some of it may have to do with what Mr. Stifler and I are going to talk about on Monday, perhaps. Some of it just got slipped, and some of it was COVID related. So I have addressed that with the folks at Galvin and their ongoing discussions right now to make sure that they do stay in compliance. I think they are making a good faith effort to do that.
I have a question, Bob. Is there a security person there?
There is not a security.
That was
Oh, thank you.
promised. I believe that was promised in the contract. Is that there or not? I'm just curious.
There's not there. So security was there through July, and then and that actually was, we contracted for that security right here at a DSS. We put an RFP out and brought that person in. But they no longer wanted to do it after the end of June. So we've sort of been living without that since then. So I asked St. Catherine's to take that up, and they're bringing in, they're going to bring in some personnel that they use in a shelter up in Albany at the Maryland shelter to sort of bring services to bear on that. But there is standing Galvin personnel 24 hours, but there's not what you would call security there.
Was that part of the original deal, or did we add that? Yeah, because we had that contract, and now I didn't realize there wasn't anybody there anymore.
Yeah, well, as far as the security, I had asked for that, and so I ended up doing an RFP for that because I wanted some, you know, I wanted professional security services there. I'm not sure that we required that of Galvin out of the contract directly as much as I wanted to bring it in. So, you know, we can certainly take a look at that and talk about it. I don't recall that being something Galvin promised. That was something that I wanted, and that I felt like if I didn't go out and get it, we weren't going to have it.
Bob, has there been a need for security?
Well, I mean, it was certainly helpful. Those months it was there, and that person who ran the company that was doing it has certainly been available on a consultant basis now. But I found it helpful because they were out there at night. They got to know the people who were out there. They got to know, you know, the neighborhood. They knew the things that I was concerned about, that there was a school just down the way. Of course, there's no longer a school just down the way, but there had been, and I was concerned about that. So I found it very useful, but I was also not able to replace it after they left.
Okay.
So Bob, just for clarification, the contract with security was separate from the contract with Galvin.
Yeah, so we put an RFP out looking for security because after the final public meetings that we were having in March of 2018, you know, it was a real concern. The folks from the school came and some of the neighboring businesses came. So I asked if I could do an RFP and bring some of those services in. And that got approved. And so we put the RFP out there. We got one answer to that. That particular company did run services through the end of this June and just did not want to continue at that point. And I I have not been able to replace that. So I do have that in mind. And part of what I've talked to St. Catherine's about is my concern. They think they can allay it with a position that they have up in Albany, because they don't keep armed security either, but they keep people there into the night that go around and do security checks and welfare checks. And so they are actually advertising for that and are going to hire somebody to do that. But by all means, I'm happy to continue to look at that and look to see if we want to supplement that with security once again and do another RFP. Again, that's something I added because I particularly at that time, given the concerns that were brought up, didn't want people unsupervised into the night at that time.
Bob, can you just keep the committee updated in reference to whether St. Catherine's is going to provide that or not and how that's going? So
yeah, I absolutely can. I absolutely will do that. And I will say, Rob, there's a meeting that's going to be set up. I know you're invited to that. We're going to try, we're just going to keep tabs on that as well, but I'll certainly keep the committee updated.
Thank you.
Hey, Bob, who's at that meeting? I'm curious. When
You know,
say-
I don't know.
Okay.
As soon as I find out, I can let you know though that, Linda, okay?
Thanks, thank you.
I know something was going to be set up.
Yeah, I've been meaning to reread the contract, and we'll do that. Maybe we can revisit this next month too. That would be great. Thanks.
We sure can. Yeah, absolutely. Thank you.
I mean, I recall when this all was going on, Mr. Kent guaranteed all these things. There was TVs, there was computers, there was security, there was all kinds of things. And somehow we're still waiting. And I just would like to make sure that things happen and the contract is fulfilled. Thanks.
No, I appreciate that. I agree, and you know, some other folks agree as well. And we've certainly kept that dialogue moving, but I appreciate the help on that score.
Thank you, Bob. Are there any other questions for Bob? Okay, thank you.
Thank you. I'll be on if anyone has questions.
Public health?
Okay. First resolution, 2 months ago, I came to you and asked you to give me permission to create a nursing position under this CDC grant to enhance our tracking and participation in ComCare, the state's system for tracking COVID individuals. And we advertised, we posted the position. I got a very small group of people applying for it. I got a tremendous candidate. She looked really great. She had a working on her master's in nursing, and more importantly, tremendous computer skills, because this position just requires a lot of computer skills. I offered her the position. I could not match what she makes in just a regular nursing position at an area hospital, and she turned me down. I didn't have candidates who were strong when it comes to the computer aspect of this. At the same time, I have an individual working in a part-time capacity for me doing the COVID stuff, who is really good at the computer stuff. I kind of overlooked her, I guess, because she was right under my nose, but she was also going to school full-time. And she came to me and said, I would really like to do this work. And so I can't, there's no comparable positions in the county structure, civil service structure. The county has always been hesitant to hire people under grants because when the grants disappear, the position doesn't. We have a relationship with the Mental Health Association with the Healing Community Grant. We have an epidemiologist who works for the Mental Health Association, but is our employee essentially. And so I would like to be able to create a ComCare specialist coordinator and allow the Mental Health Association to be the employer of record and to be able to do this work.
Are there any questions for Jack?
So I have a question. Is the mental health department hires the person and they work for you? Is that right? It's very confusing. Let's see.
It is, yeah, it's, well, if actually going back to my reporting days, Linda, the healthcare consortium was created by the county in part to do this kind of function where if there was a grant that came down that the county couldn't apply for because the county was not a not-for-profit, or if there was a grant that the county really wanted to participate in, but they didn't want to create a permanent position. So we've had a couple agencies, the Mental Health Association does it, the Healthcare Consortium does it. Our Healing Community Studies manager is an employee of the Healthcare Consortium. Our epidemiologist is an employee of the Mental Health Association. They are employees. They get their benefit package. They get their, accumulated time and whatever. But they're essentially stationed in our building. They're stationed here. We supervise them day to day. I know Mr. Gibson remains on the line. He has a few employees that are in similar situations placed in it. It's a pretty common practice. And again, what happens if you have a grant that only lasts 2 years, you hire for a not-for-profit, and then when the grant goes away, the position goes away.
So Jack, this is Matt. I thought yesterday we said it was the Healthcare Consortium, but it's Mental Health Association.
I did the Healthcare Consortium yesterday. It was the Mental Health Association. Yeah.
Okay.
We use them both, and the Mental Health Association was, enthusiastic about embracing this and the cause and everything else. So we're going with them.
Okay, I'll move it.
Second, Fury.
All in favor? Aye.
Aye.
So carried.
So this is like Mr. Gibson. This is the time of the year when you send a resolution to the committee to grant the chairman authorization to sign off on routine agreements that we have with various state health departments, the Columbia University. The next page, the appendix, is a listing of all the grants: our TUPA grant, our water grant, Healthy Neighborhoods grant. These are really routine renewals. So this is a year-to-year thing.
Any questions?
I'll make the motion.
I'll
Second.
second.
All in favor?
Aye.
Aye.
Opposed?
Aye.
So carried.
We have various contractors that work for us. A lot of them are within our early intervention program, speech therapist, physical therapist. We have a pharmacist that has to come in and take a look at how we refrigerate our medications. These are routine agreements that have to be renewed on an annual basis. So we're looking, again, same thing, give the chairman the authority to just renew them on our behalf. And there's the list of all of our various contractors.
Questions? Motion?
I move it.
Second?
Second.
All in favor?
Aye.
Aye.
Opposed? So carried.
Another routine thing that we do on an annual basis, we are fairly aggressive when it comes to allowing students from nursing programs or from across the region to come here and do their internships, and so that they are getting practical experience on the job. My nursing staff enjoys doing that. So there's an appendix attached to this as well. The various agreements that we have with various nursing schools. They go out pretty far. Of course, some of this is done online, but I think we're one of the most aggressive in the region when it comes to saying yes to taking students.
I'll move it, Fury.
Second?
Second.
All in favor?
Aye.
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 Opposed? So carried.
Okay, this is just accepting the funds through the Healing Community Studies program. So we're in year 2. They're giving us over $300,000 to fill various positions, 2 of which we have filled, and they're giving us over $400,000 for what's called impact dollars to be spent in the community. They're encouraging us to work with a single agency that's a provider, and we've been talking to Twin Counties to do this. This is just accepting that money.
I'll make the motion.
Second,
Second.
all in favor?
Aye.
Opposed? So carried.
Jack, I think I'm missing the resolution on the part-time COVID clerk,
Yeah, that should be next.
right? That didn't come up.
I don't see it up here at all.
Okay, if you want to go over your report and I'll kind of look for it quick to pull it up, hopefully.
Okay. All right, so aside from this is the environmental report for September. Some of you have, I know we got a press release out yesterday in regard to Ghent Assisted Living Facility. We have 26 positive individuals in the assisted living. It's a group home versus a nursing home. As of today, we had we're up to 3 staff who are positive. The administrator there is being very aggressive about testing, and it actually has led to a little confusion because she's retesting positive. And so we thought the count earlier today was up to 29, and then we realized that some duplicates in there. This is a tough situation. We had this outbreak with Barnwell and Pine Haven, for that matter, earlier in this epidemic. We have a higher percentage of people hospitalized this time around. And if, in a way, this is a group that's slightly healthier than a nursing home population, because these folks can come and go as they please. Several people have their own cars and whatever. And yet we've had 10 people hospitalized out of 26. So who knows what the science is here? Who knows if this is just a really strong strain that's coming through here? They've identified something like 300 varied strains of this, but I think this has been really tough on that population. But the administrator is working hard on this. She's aggressively testing. I'd like to be optimistic that we're kind of capping out at the 26th. The 26th person though tested positive this morning and has already been hospitalized. She's in rough shape. So this is a tough turn for that facility. We were also informed as of this morning by the nursing home that they have a positive staff person. That person is out on isolation at this point in time. We're hoping that kind of stays with that. And that's all. We've had a positive staff in the Whittier. We call it Whittier. Everybody knows it as Whittier. Before, and it didn't spread. I'm hoping that's same thing happens there. Brookwood and Columbia secure facility. There's boys and girls facilities out here. We're up to 4 staff people at the girls facility with 3 girls who are positive. We have 2 staff on the boys side who are positive. Those are positive Columbia County residents. We also have 10 more positive individuals who don't live in Columbia County. They're staff from other counties. So that's a big hit out there. That facility has got to be struggling when it comes to staffing. But that spread like wildfire through that one. I guess since we're on here's the resolution. So 2 months ago when we created the nurse position, we also created the part-time clerk position. That's the position that our hopefully soon to be coordinator is in. This resolution officially abolishes the registered nurse position, but also allows us to fill the part-time clerk position. So we're going to fill it with another individual because we need a lot of support in that whole COVID effort.
I'll make the motion.
Second,
Second.
all in favor?
Patsy.
Aye.
Aye, opposed?
Aye.
So carried. Are there any other questions for Jack?
Yeah, Jack, I have a question about the assisted living, because I read, I think in the paper that there's not like a doctor on call, that everybody has their private doctors. Do you think that makes a difference in catching things earlier in a situation like that?
Well, I think that, you do have staff that are there to check on residents, check on, temperatures and symptoms and things like that. In this particular case, I'd say, no, it didn't make a difference because they had a staff person who came in who was symptomatic, who was tested right up front, who was positive very early in the game. the administrator said, I'm not taking any chances. I'm going to test my residents. And she went right at it the day that she found out that the staff person was positive. And that's when, I mean, it's been like a week and we're up to 26 people. So she was very aggressive about testing. So I think in this particular case, it probably wouldn't have made any difference because that index case was a staff person, as far as we know.
Jack, I have a question. Are these related to the Greene County Correctional Facility? These?
It's not possible for me to say 100% to that, except that our understanding at this point is that the significant other of the gentleman who we identified as the index case in this facility is a secretary at Greene Correctional Facility, where of course they have 91 or 92 positives, and she was positive. Could it have flown the other way? Could it have been the gentleman at Ghent giving it to her that put it in that facility? That's possible. It seems like the timing is he got sick first, and then we found out that she was sick simultaneously with him. It is connected. There's no doubt about it. Whether or not which way it flowed, hard to know.
And one last question. How fast is the turnaround on the test that you're giving here?
It's still 1 to 2 days at this point in time.
Thanks.
24 to 48 hours. Sometimes we had a test clinic this morning at John L. Our first inside worked out very well, and we normally run somewhere in the 70s. We've been capped at 100 by Wadsworth, and we got to 100. It was definitely a higher demand. People wanted to be tested, and some of those results started to trickle in this afternoon. So Wadsworth is turning them around pretty quick.
Linda, just to add to that, the quickest way for someone, especially one of our county employees, to get a test would be to go through the health department and to get the results. That's about as quick as we can seem to turn it around through the health department and through Valatia. So that's what we've found that is to be the quickest at this point. So that's about as fast as we can do it. The other thing is we are looking into these rapid tests. Jack, do you want to just elaborate a little bit on that, please?
So this past week, the state of New York announced that they had their share of it. So the federal government went to Abbott, which is one of the main distributors out there, and they bought up their entire inventory, and they bought up everything they're going to be making for the next couple months. And New York State's allotment was 440,000 kits. So we, as a health department, we were told we want you to start using these antigen tests. These are tests that essentially there's a swab that gets put on a card. It gets folded over. There's no machine that needs to read it. The results are available within about a half an hour. And so we did put an application in for 5,000 kits. We've been told that the bulk of that 440,000 went downstate, which is where you sort of might expect it because they're in the red zone down there. But as more kits become available, they're going to send them out to the counties. They told us that we shouldn't expect our full allotment, but that they would continue to send these out. They want us to predominantly to use these to back up schools when it comes to rapid testing. So if a kid has symptoms that really look like COVID, rather than send them home, we can test them on the spot. This might help us if we have a true outbreak. On the other hand, the requirement is that we make them available to the whole public, equally so. And so we are probably going to be having some clinics using these antigen kits. There are another group. There's 5 antigen kits that are available on the market. 2 of them are the Abbott test that you cannot purchase, as we tried to purchase. A couple of my counterparts in other counties tried to purchase them, and the feds have it all locked up. But the other kits are available. They're a little bit more expensive. The Abbott's around $5. These other kits are a little bit more expensive, and they require a reader. We've learned that the readers are around $2,000. So we have discussed this week with the chairman the possibility of us using some donated funds to buy additional kits through some of these other companies. Obviously, we'd have to spend the money to buy the equipment to do that too. but that would allow people to be tested and to know on the spot. And that would be a great asset to the county, and knowing if they've got an employee who's positive, rather than send them home for 14 days, it would be a great asset to the county. So we're moving in that direction.
Yeah, I mean, the small group that meets, there's full support on that. So we are looking into it. As he said, the chairman is behind it as well. I think it's imperative if we can get them to get our hands on them. I think it would be a big asset to the county. So once we have the availability and once we get a definitive price point on it, I'm sure we'll be able to pull the trigger on them. Are there any other questions for Jack? Thank you, Jack. I appreciate that. Jack, just a quick one more question. What's the accuracy on the Abbott tests?
97 point something %. That's about as high as it gets with those tests. And I'm glad you asked the question, because usual protocol with these antigen tests is that if you get a positive, you follow up with a PCR. You do a typical swab, and you follow it up as a backup to that. So people who do test positive on the antigen are nonetheless going to be swabbed. So it's still something that we're going to end up doing.
Any other questions? Thank you, Jack.
Okay.
Dan, you're up.
You bet. Good afternoon, everybody.
How are you?
I'm good, thanks. I would just like to, and I don't know if this is unorthodox or not, but I just want to acknowledge and say how grateful I am for the work of the health department and everybody involved in the effort that we just heard about, and that's been going on since the inception of the pandemic. It's really impressive, and those are just my personal thoughts, and I just felt like saying them out loud.
Yeah.
It's really nice to hear that we're in such good hands as a county, and that everything's being done to take care of the residents and the employees of the county. All right, so what we have in front of us is the first of 3 resolutions, I believe. This one has to do with our desire to phase out some of our electronics. Historically, we've tried to purchase updated electronics in the form of desktop computers and laptop computers and such every 3 years to keep up with the demands of technology and how quickly what was once new technology becomes old technology. It's been quite a while since we've done that. So our latest attempt and our proposal here is that we phase out our desktops, so to speak, and we go to laptops for all of the staff. So currently we're maintaining 2 tracks of technology, meaning all of our staff have laptops, and all of our staff, when they come to work, can operate off of a desktop. So that, can be costly and, problematic when it comes to maintaining and updating and so on and so forth. So what we're asking for is to replace all of the laptops and all of the desktops with a laptop that will have increased speed, memory capabilities, and so on and so forth, so that we can conduct our remote work as well as our on-site work with one piece of technology.
I think it's important to note that it's a grant and the money's already in hand. It's not something we're waiting for. Is that correct, Dan?
Yes, thank you, Rob. I'm sorry for leaving that out. The department had already budgeted funds in our 2020 budget for technology upgrades and such. This goes a little bit beyond that, but the monies that we're using is referred to as federal salary share money. This is money that comes to us from the federal government. We have this in the bank. We're not spending money that we do not have. We have this money, and it is available to us to spend. And this is certainly an indicated and appropriate use of this type of federal salary share.
Any questions for Dan?
Got 227,000 of federal salary share in just recently.
Yeah, thanks, Ron.
Thank you, Ron.
My question has to do with the reduction that we asked all of our department heads to do. This is aside from that reduction to 20% or so that we asked people to do. In other words, this is extra. This is money that was sitting there in another bucket.
Yes.
Okay.
Yeah, it is, Rob. It's in a special account. We keep tracking how much we have. I think we got over 400,000 in this account.
Okay.
That's correct. We just had some installments land in our account. I think it was from Joe Ambrose could chime in if I get it wrong, but I think it was from maybe the third or fourth quarter of 2017 or 2018, and then some monies from 2018 that were just credited to us.
Yeah, it's 2018.
Okay.
And furthermore, I checked out with Rick DiGiuliano and Mike Lehman, and they made sure we went through all the proper procedures and protocol with procurement, make sure we got state contract rates and so forth on the pricing.
Okay. I'll move it.
Second.
Supervisor Mussman, all in favor? Aye.
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 Opposed?
Thank you. Much appreciated. Let's see. Okay, this is a resolution allowing us to, with our current electronic health record vendor, which is known as 1011, we recently renewed a contract with them for a period of 5 years. However, at that time, it was not known to us that we needed to have them write an additional script with regard to an insurance carrier, managed care company called Capital District Physicians Health Plan, Child Health Plus. So we need this programming piece done so that we can bill for our clients that have this particular type of insurance. As you'll see in the resolution, the cost is quite minimal. It's $250. The amount of revenue that this will allow us to generate will far exceed that.
Any questions? Motion?
I'll make a motion, Patsy.
Second?
Second, Sterling.
All in favor?
Aye.
Opposed? So carried.
And this resolution has to do with an initiative that we're involved in which we're receiving monies from an entity referred to as Better Health Northeast New York, and specifically a transition of care project. The transition of care project involves several local providers, including the hospital, Columbia Memorial Health, Twin County Recovery Services, the Mental Health Association of Columbia and Greene Counties, as well as the Healthcare Consortium. And the emphasis is for all of the providers, including ourselves, to work more collaboratively in dealing with folks coming out of the inpatient psychiatric unit, to do what's called warm handoffs, so that a person coming out of the hospital is successfully transitioned to an outpatient provider, as well as the other providers I just mentioned, so that their needs can be met, so that they don't fall through the cracks, and ultimately so they don't end up back at the emergency department, which, as we all know, is the most costly place for any individual to receive care. Our participation in this initiative is rewarded in the form of funding. So this resolution would simply allow us to accept those funds, which are dispersed in an incremental manner.
Any questions? Motion?
Motion, Sterling.
Second?
I'll second it, Bury.
All in favor?
Aye.
Aye.
So carried.
Thank you. And then finally, we have the overtime report, which is, as you can see, started out as $15,000, excuse me, $15,000 budgeted. Year to date, we've used $815.40, which brings the remainder to $14,184.60.
Any other questions for Dan?
Congratulations on that, Dan.
Nice job, Dan.
Okay, thank you, everybody. I appreciate it. If there are any questions about anything we've talked about historically or any updates that people would like, I'd be happy to give them. Otherwise, I will sign off.
Again, Dan, I
Take
just
care,
want to
Dan.
stepping in. You've done a great job. We really appreciate it. Thank you.
I appreciate that, Chairman. That means a lot to me. Thank you very much. You and many others have been very helpful, and I'm very grateful for that.
Well, thank
Have
you.
a good evening, everybody.
Thanks, Dan.
Is that it?
Kevin McDonald has a resolution. Kevin, you're gonna have to hit *6 to unmute yourself on your phone.
Okay, everybody hear me?
Yes, go ahead, Kevin.
Oh, okay. Okay, yeah, I have one resolution request asking to fill 2 part-time site worker positions. About a year or so ago, we had a resolution passed establishing a pool of 6 part-time site workers. We're down to 4 right now. We've really tried to get by with these 4 positions, but we're starting to approach a time where a lot of our other workers we have a couple of people going out on medical, and we're going to have some people going out on vacation, and we don't want to run the risk of not being able to serve the seniors, their meals. So we're, like I said, it's the money's been budgeted. It's just that we have really diligently tried to not have to fill these positions for as long as we've kind of held out as long as we can. And we're just seeking permission if we could fill these 2 part-time positions.
I make the motion. Eldridge.
Second, Sterling.
All in favor?
Aye.
Aye.
Opposed? So carried. Good luck filling those positions, Kevin.
Yeah, thank you very much.
I know it's going to be tough, Kevin, but thank you for what you do. You do, a big service.
Thank you. I appreciate that.
I know you do.
Is that all?
Has anybody have any other questions?
Just a quick one, Kevin. Did we decide to open up any of the centers where we were distributing meals, or?
Yeah, yes, we've been open down in Livingston, and that site is our Elizaville Firehouse. We've been open there for about a month, and we've got really strict guidelines in place that we ran through the health department, and the people are very receptive. Just about all of them have come back. They're wearing masks. They're socially distancing. We've changed the way we serve our meals quite a bit so that, that there's not a lot of milling around or people touching food. It's just everybody gets served their meal. We're using plastic flatware. Everything's disposable, and it's running pretty well. We just recently opened our site in Stuyvesant Falls. Our numbers are not where we would like to see them. However, we're giving people a chance to maybe adjust, and we're hoping to open in Hudson 2 days a week and in Valatia 2 days a week within the next month.
Just another note to everyone. They're really hurting for volunteers, especially I think in Hudson and Greenport. Is that correct, Kevin?
That's correct. Thank you.
Well, if at all possible, supervisors would put something up on their websites or at least get the word out. They're really having a challenge finding people to distribute meals. So there have been a lot of people that have asked if they can help. That's surely an area that we could use some help. So
Could I ask?
It out would be very helpful.
Hey, Rob, could I ask that somebody put together an email, let us know when and where these locations are and what hours, and we could post it? Definitely.
Kevin, can you put something together and maybe ask if we could get it to Kelly? She could distribute it out to all the supervisors.
You mean similar to what I gave for you?
Yeah,
that type of a thing. Yeah.
Yep.
Okay. Sure. No
That'd be
problem.
good.
Thank you.
Thank you.
Thank you.
Anything else from anyone? Motion to adjourn?
Motion.
I'll make that motion. 5 o'clock.
I think we had Supervisor Sterling made the first and Supervisor Weaver made a second. All in favor?
Aye.
Aye. Opposed? So carried. Thank you, everyone.
Thanks,
Good night, everybody.
Thank you.
Good night.
Night.